All right, good morning. My name is Dr. Kylea Frei, and I am with Gym City Behavioral Solutions. We work with a variety of individuals. We are also a autism scholarship provider and a John Peterson scholarship provider. We do community behavioral health, so we provide mental health services. We also provide specially designed instruction for our students who choose to come to us in place of public school. But we also have individuals that attend our facility in addition to attending their school of choice, just for extra services that they may receive. I've been in the field for about 18 years now. I have been working with a variety of individuals, primarily autism, but also a lot of dual diagnoses. And we have just really changed a lot in our field since I've started. So even the information that we're giving to you now has changed over the time since I began in this field.
And hi, I'm Timberlake, and I am the parent mentor for Kettering City Schools. And so some things you should know about me, a little bit about me and my role is I'm the mother of a almost 18-year-old with Down syndrome. He turns 18 in a month from now. And so right now we're in the process of applying for guardianship and doing some things that we need to do to get ready for adulthood. And so that's the primary thing I want you to know about me. I've been through this process many times with my own son and recognize how hard it is even for professionals who do it, for lack of a better word. My role in the district is that I'm a parent mentor, and so I work with families of students with disabilities, and my role is really focused on educating and equipping parents to advocate for their child to get their needs met in a public school district. Many times that looks like just supporting you in a meeting, being that friend who comes and sits beside you so you don't feel alone and overwhelmed in a meeting. Other times it's meeting outside together, having coffee, and just talking through the concerns that you have about your students' education, as well as helping you to express to the district your perspective. I have a lot of training in special education law and in processes. I've been doing this. This is my 11th year starting out. I started when my son was in second grade, and so it really, as Melissa, I so appreciate you sharing your story earlier, just about your experiences, because it is a hard process for parents, and it's very easy to get lost in the process.
And imagine being a librarian whose job it is to help people find information, feeling lost. That was like, if I can't do this, how hard is it for other people who don't do this every day?
Absolutely. We so appreciate the ability to just come and talk about this because we do need each other as we go through this process. We do. And so I just have a question. We thought we would start out just asking what you hope to learn today. Why are you here and interested in learning in the special education process? If anybody would be willing to share that.
It is hard to know, right? And I have a brother with Down syndrome, and my mom felt like how he's now 50. So imagine, when she was fighting that fight, the information was so much harder given then. Unfortunately, we just got an autism diagnosis 6 months ago, and our daughter turned 13 2 weeks ago. So where you feel very behind and like we've failed her, and just kind of trying to catch up and figure out how do we, what's the best way to kind of catch up, right? And what are the processes? And then a couple things that you mentioned, just introducing yourself about, in lieu of an education, in maybe a public school setting, there was something else you had mentioned. I'm super interested to kind of hear what I had no idea there was something like that. So just kind of finding out exactly what is available and how to find those and get involved with those.
Anyone else? So I want to speak to the mom guilt briefly. I can't resist not speaking to the mom guilt because I know what that's like to lay in bed at night and think how many ways I've failed, how many ways that I could have done something different, opportunities that I've lost along the way. And so I think that's a common theme as moms and as families and as parents for this. And so we can only do what we can do with the information that we have. Sometimes the road, this process, whether it be a medical diagnosis or whether it be special education services, it's not a clear-cut path a lot of times. And so for me, I'll speak for myself, I have to forget yesterday, learn from yesterday, but then just take the next right step. What is the next right step today? And so, and I believe personally that you being here is a great step in doing that.
So we do not have the presentation posted behind us, but you do have access to the slides, which is what we are going off of. So if you go to the section that says the special education process, we are going to go through some of the reasons why this process can be confusing for parents. So there's complex legal framework. So this process is governed by laws such as the Individuals with Disability Act, so you'll hear this a lot as IDA, which includes detailed regulations that parents might find difficult to understand, terms like free appropriate public education, which is known as FAPE, and least restrictive environment, LRE, and various eligibility categories can be very overwhelming. There is a lot of alphabet soup with this process, and if you don't know what each of those things are, it can be pretty confusing. There are multiple steps and procedures, so from referrals to evaluations and eligibility determinations to developing an IEP, which is the Individualized Education Program. There's multiple steps involved, and there are a lot of individuals involved as well, and that can be a little overwhelming. And then there's the difference between an educational disability and a medical diagnosis. So parents a lot of times struggle to grasp with the difference between a medical diagnosis and an education disability. A child might have a diagnosis, diagnosed condition, but may not qualify for special education services if the condition does not impact their learning according to the school's evaluation process. And then there are different stakeholders involved. And I can attest to this given I have been on multiple ends of the table. I myself, as a child, I had an IEP and an ETR. When I was younger, I was told to my mother that maybe education isn't right for me and that maybe they should look into something else. I had severe dyslexia, and I still do. I just know how to cope and deal with ways to work through that. And it was from that moment that my family wanted to push for me to do anything they could to help me learn. And I sat at the end listening to people talk about me as if I wasn't present. And so I learned to become an advocate for myself at a young age. I was able to learn to read when I was in 5th grade. It took that long for somebody to actually take the time to do that. And so that was given to a stakeholder that was a special education instructor that took the time to work with me and understand that diagnosis and be able to teach me the skill sets that I need to be able to read. So there's going to be a lot of different stakeholders involved in this process, including school psychologists, teachers, other individuals. Now, on the other end of the tables, I'm a board certified behavior analyst. I also am a qualified mental health specialist, and I also advocate for a lot of our parents. And so I attend a lot of IEP meetings and a lot of ETR meetings to be that other person there to kind of support through that.
And so as Dr. Kylea talked about, there is a lot of jargon and technical language that's involved. And a lot of time, I've been in, a large portion of my role within the district is attending IEP meetings for a lot of different reasons. Sometimes it's just to introduce myself, and other times it's because the parent of the district has asked me there. But as educators, what I find is a lot of times we get so used to talking to each other in a special language. And it truly is a special language, and we use a lot of acronyms and a lot of those around the table. And It's intimidating to ask questions. It's intimidating to, I used to jot down, I would just write down all the acronyms, all the letters, and I would go home and I would like look them up on the computer trying to figure out what in the world they were talking about. And so that's one of the things that does make it a complex and confusing process. There's a lot of timelines and procedures that are dictated. For Ohio, it's the Ohio Operating Standards, and that is federal law translated into state law. And so there's a lot of timelines and different things that the school has to follow and is required to follow. Otherwise, then we're out of compliance with the Ohio Department of Education and Workforce. There's some decision making involved as a parent, when to push, when to pull back, what to do, how to advocate, how to continue having a strong relationship with my district while still advocating well for my child. Those are all difficult things to do, as well as sometimes there's inconsistent communication. Educators a lot of times will forget to communicate all the important things, all of the good things, or in detail on some of the more challenging things that happen in the school. And then also there's some emotional factors, as we talked a little bit about earlier. It's hard having a child with a disability. It's hard. Oftentimes spouses process things in different ways, and sometimes it's hard to advocate when you're in that emotional state. And so hopefully today we'll be able to dispel some of that. Our goal for the day is really, like I talked about, is just to dispel some of the most common misconceptions. As Dr. Kylea said earlier, medical diagnoses versus an educational disability. And we have some learning objectives that we're going to talk about today. First is to understand what is the definition of an educational disability. The next thing is to learn the key steps in the evaluation process. And then third, we want you to understand what your parent rights are. Sometimes that's enough to really feel empowered to advocate well for your child. We hope that by the end of the day, this education will clear some of that confusion up, as well as empower you to move forward with your child's application. Yes?
So I actually have a question. And so when you guys refer to the district, I assume you're talking about Kettering, right?
Any district.
Okay, so you guys, the work, you can work in any district, or do you specifically work in Kettering?
So I work with multiple districts.
Okay.
As a provider, as a scholarship provider, anybody with a scholarship can attend any provider that they so choose, and it does not need to be in their district. What I also do is, as a scholarship provider, I attend the IEP meetings for all of my students, because they attend our facility, and so they're not in the district. So the school district, if they are still required to write an IEP and ETR as if they were in the school district. And so what I typically do is I put together the present levels of performance, suggested IEP goals, and then I also go to the meeting to go over all of that information with their district that is responsible for the IEP and the ETR. Because what we're talking about today is the ETR process, which is the evaluation team report, and that is what's going to drive what goes on to the IEP. And an evaluation team report is done every 3 years, where an IEP is done every year. And so when I meet with districts, I go and I take all of my information, I send it to them weeks beforehand. We work collaboratively to put together an IEP, and then we meet with the family for the IEP meeting.
Gotcha. And then this is probably a stupid question, because you did mention that it's by state, but so I assume that every district basically has the same rules. Okay. All right.
Yes.
Yeah, every district does have the same rules, and as I mentioned earlier, it's federal law translated into state law. There's this huge booklet, it's called the Ohio Operating Standards, and that is what dictates all of the rules and guidelines and definitions that we'll talk about today. My role is a little bit different from Kylea's. I do work directly with Kettering and Kettering families. However, there are parent mentors in many of their surrounding districts. So there's a parent mentor so someone in a similar role to me in Oakwood and Centerville. There's one in Beaver Creek and Bellbrook. And by the end of the presentation, also we'll give you some additional resources in addition to parent mentors that you can reach out to as well. Yeah, great questions. So we thought the most important thing to start with is understanding an educational disability, what it is and what it isn't. An educational disability is a condition that has significant impact to a student's ability to access the general education curriculum or make progress in the general education curriculum. The interesting thing about it is it's got to be a significant impact for the state of Ohio to identify a student as a student with a disability. There has to be a significant enough impact that they require specially designed instruction, which is one of those educational jargon words that we talked about, right? Right? And so this is, at a core, in very parent-friendly language, it is education that's different from the general education population. And so it's different in methodology, it's different in delivery, it's different in content, and it should be provided to meet the needs of that child's disability. So it's individualized for every student that receives special education services. To have an educational disability, you have to have a multi-factored educational evaluation by your district. And then the district, that's the process we're talking about today. There are a lot of steps in doing that, and we'll provide a lot of information in that multi-factored evaluation. Also, whereas medical diagnoses, there's an exhaustive list of medical diagnoses. For disabilities, for educational disabilities, there are 13 disability categories. And so to have an educational disability, your student would fit into and meet the criteria for one of those 13 disability categories. A medical diagnosis is a little bit different, and so it is about a medical condition or a person's health and development. The diagnosis has to be made by a medical professional, and then it has to meet specific medical criteria. If you flip the page, there are some key differences in this between a medical diagnosis and an educational disability.
So this little diagram helps break it down so that you can understand a little bit better how that process works. So if we're looking at a medical diagnosis and an educational disability, so the scope is a medical diagnosis is addressing the overall health condition of the child, while an education diagnosis focuses on how the condition impacts learning. The purpose is a medical diagnosis is for treatment and management of the condition, while an educational diagnosis is to provide the child with special education services and accommodations within the school. The criteria for this is that medical diagnoses use clinical guidelines such as the DSM-5 and ICD, whereas educational diagnoses rely on IDEA definitions and criteria to assess the child's educational needs. And the eligibility for these services. A child can have a medical diagnosis but not necessarily qualify for special education if the disability does not significantly impact their ability to learn in the school setting. A child might qualify for special education services through an educational disability even though they don't have a formal medical diagnosis. So there's assessments that the school can do to determine if they would be eligible for an IEP even if you don't have necessarily a medical diagnosis for that. So to give you an example, a child diagnosed with ADHD and a medical diagnosis might not qualify for special education if the ADHD does not severely impact their educational performance. However, they may still receive accommodations under a 504 plan. On the other hand, a child with ADHD who struggles significantly in school may be eligible for an IEP under the other health impairment category through the educational diagnosis.
I think that's one of the hardest things for families to grasp. And, you know, a lot of times there's such a plethora of differences in how a disability affects an individual. And so autism is probably one of the most recognizable differences, right? Autism expects, the saying is, if you've met one person with autism, you've met one person with autism, because it impacts kids so differently, individuals so differently. There's a large array. And so when the educational system is looking at that, they're not just looking at, okay, this child has a diagnosis of autism. They want to really understand how autism impacts them in the classroom. And so that's what the evaluation process helps. It's not enough for an opinion, like an observation opinion. You have to really dig in and take a look at things. Yeah. And so the next slide is the 13 disability categories. I mentioned earlier that there are 13 disability categories, and those are the categories. Federal law and the state of Ohio provides a definition for each of the categories. And there's specific criteria that has to be met in order to be identified as having an educational disability in that area. The criteria is different, as we mentioned, from that of the medical field. And I gave you a handout, and it looks like this. It says Ohio Educational Disabilities, I think is what it's titled. Oh, Ohio Disability Categories. It's a stapled page. And so this is straight out of Ohio's operating standards, so straight out of our law and our code that gives a definition for each disability. And so this will go through and tell you to have educational diagnosis of autism. It'll give you the definition. That's the criteria that they're looking for, and that's how the impacts that they're looking at. I want you to look a little bit and look at a few of the definitions and the adjectives used in the definitions. And so, for instance, it says autism means a developmental disability significantly affecting verbal and nonverbal communication. So that adjective, significantly affecting. If you look at deaf blindness, it says in there, the combination of which causes such severe communication and other developmental and educational needs. So that word severe, the adjectives they use is severe. Emotional disturbance, it talks about that it has to be over a long period of time and to a marked degree. And so those adjectives are clues of what they're looking for. In general, there has to be a significant difference between the student and their peers, essentially. And so if you were to look at them in a classroom, you might recognize that there's something that they learn differently. If you look at the next slide, I need visuals. Like, I love adjectives, but I need visuals. And the bell curve is just something that's just easy to look at and understand because we're all familiar with the bell curve. And so if you look, those two sections, that's the average range, either above average or the average range. The next one below it is below average. And then additionally, there's low and extremely low. Some of the other words you might hear would be moderately delayed or severely delayed. The sections that they're looking at for an educational disability is not the below average range. It would be in the low or the extremely low. And so there is a higher degree of criteria that has to be met in order to qualify for an educational disability.
So on this next slide here, it is talking about gathering data about your student, what to record, and types of data to collect. So you want to date any specific conversations with schools, keeping that information so you have like a timeline of the communication and the data that you've collected, the times of the week, whether those be emails or phone calls, any of that communication, the time of the day, how is the student behaving in the morning versus the afternoon, note the individuals that are involved. So any kind of behavioral changes, we know that change is hard for all individuals, but let's say there's a sub that day, and then you see a spike in behavior. Well, that information can be very helpful to guide on what to do next time there is a sub. Describe the data, observations, important information. All of these things are great because it helps give a better picture of what is occurring for your child, and keep that information factual. Medical information as appropriate, grade, testing, screening information, any interventions, special education, their previous history. While it's not your responsibility to gather data, it helps the district to understand your perspective and will help support your evaluation request and make it difficult for the district to say no to an evaluation. The squeaky wheel gets the grease, I guess is the best way to put this. The more you push for the child, the more that they will be in the forefront, and you can get that evaluation. Even if that evaluation comes back and they say no, they're not eligible for any of these categories, you've still pushed for that and you've gotten information to help guide you. It does not mean that your child may not be eligible for special education in the future, or you can take this information, continue to gather data. As we know, a lot of times when students are entering into the school for the first time, their behaviors look a lot different at the beginning of the school year than towards the middle of the school year. Myself, working as an outside provider, this is the time right now where I'm getting a lot of phone calls from school districts asking me, hey, can you come do a functional behavior assessment for us? Can we contract with you to take this kid? Can we set up a scholarship meeting so that we can potentially, transfer a student over to you because they need additional support and maybe the district is not the best placement for it, or they contract with us to come in and help support within the district. We do both. Any way that we can help is how we support, at least as a provider. But this time of year is pretty popular for that.
Yeah. And why is there such a pushback from the district? Is it like a funding issue, or it's more paperwork for them, or why is there such a pushback?
So I think that it is not always a pushback. A lot of districts are very willing to meet the needs of their students. It's just sometimes they're not aware of it, or it hasn't been addressed in a particular way. I don't think that districts are out there saying, "Hey, I don't want to provide these services," but it might be enough to push a little bit more. And I'm sure you can speak a little bit on that.
Yeah, thanks. And I agree with Dr. Kylea. I don't think districts actively are refusing without reason. And we're going to go over some of the reasons the district might decline. And certainly we can't speak for all districts and all personnel of all districts. But a lot of times what the parent sees and what the district sees are two completely different things. So for my daughter, who struggles with anxiety and depression, she held it together at school, right? At school, she did her work. She was in some honors classes. She was well-liked. She was a basketball cheerleader, all of these wonderful things. But she would come home and see me and break. And it was like sobbing. And so a lot of times there's just that difference between home and school, and helping the district to see perspective is one of the things that you can do to advocate for your child. Homework, another great example would be homework. A student that has spent all day at school doing things, and the school doesn't see any, they're not a lot very different from their peers, but you get home and homework is like an all-out brawl at home, right? There's a difference sometimes between what the school sees and what the district sees. And I think for me anyway, that's why the gathering the data is so important. And I've used this in my own son's education, and I still continue to do it. I keep a running Google Doc. And so on the Google Doc, I record exactly what's in this chart. I record the date. The day of the week is super important. The time of day, all of those different things. And so for instance, my son, who is so mild-mannered, he is the quiet guy in the classroom, and he is behaviorally, he does super well. He's, in fact, in his IEP, it's like he follows rules 100% of the time. And so, but what we found, his sophomore year, I started getting calls saying that he swiped someone's computer off their desk. I'm like, are you kidding me? I mean, he is a mild-mannered guy. Or he would put his head down and refuse to do anything, which is so unlike him. I always say he has an obedient heart. Or they would call, and so I just started documenting, right? I just started documenting the date, who I talked to. I used the specific words that were said, the specific actions. I asked questions, what was going on before, what was going after. I even asked, is there anything different on this day than any other day? And the answer was no, nothing different. But as I documented what had happened with my son, I found that it was every Tuesday. Every Tuesday at like 1:30, I could count on getting a phone call. And by having that, I could ask some more targeted questions about what was going on. And for him, what was going on is they were asking him to do, it's a fine motor skill task box. And fine motor skills are difficult for him. They are not his thing. And so he was refusing them. And because they weren't hearing and weren't seeing, they just thought he was being rotten that day. And so that's why the gathering the data, you have to help the district see from your perspective. And I think the gathering the data will assist you in that.
So now that we've talked about all the stuff beforehand, now we can actually jump into the special education evaluation process. So step one, we just now got to step one, and there's all this that we just discussed. So step one is requesting an evaluation for the special education services. The request to evaluate can be made by either the district or the parent. In either situation, the parent must sign consent for the evaluation. So this is a really important step. I usually guide my families that if they need to have an evaluation process, that they send a letter to the district that says, I give permission for my child to be evaluated, and they sign it, and that kind of gets the ball rolling for the district because you're giving that consent. We'll talk a little bit about timelines, but there are a lot of timelines attached to this. So they have 30 days to get consent, and then they have 60 days to do the evaluation process, and then the ETR has to, or the IEP has to be completed if they are eligible, determined eligible, 30 days after that. So if you don't do some of the steps in this, it can make your timeline very long, because just right there we're talking about 4 months. And while most districts are pretty proficient and that doesn't take them 4 months, it could. So step one, make sure you request for that, and it's in writing or in an email. It should be sent to the principal or the special education coordinator or the teacher. A lot of times I say send it to everybody. Everybody gets it. Just multiple copies of requests so that everybody knows that that request is happening, and that something can't be lost or somebody can't misplace what your request was. You've documented that you sent that as well, so you're keeping that, recording that information yourself. And your request should include your concerns, any important information that you've already collected, things that can be very specific that can help with the evaluation process, or again, show the district your perspective of your child. I work with a lot of individuals who are very good at masking. So they mask throughout the day, and then they just fall apart at home or out in the public or anywhere else outside of school. And so it's good to get that information to the district. The referral process begins when somebody requests for that to make the referral. Again, parents can do a formal request for an evaluation if they suspect their child has a disability. I know a lot of times too, if you get a medical diagnosis, you can request as well to say, hey, I want them evaluated to see if they would qualify for an educational diagnosis as well, and to receive those services. Once the referral is made, the school must obtain written consent from the parent before conducting any formal evaluations. And parents must be fully informed of the process, the tests, and their rights.
And so one of the things we gave you in the packet is a sample letter. And this is just a template that I pulled off of the internet from a website. And so it just gives you, it's just a formal letter that you can fill in the blanks for your child if you're requesting an evaluation. The biggest piece is like using that data that we just talked about to build your case. Make it hard for the district to say no. Help them to see your perspective. And so we've talked about step one, and that's making that request. Step two is determining whether or not the district suspects an educational disability. And so I'll tell you, best practices is that happens in meeting form. And so typically what I see happen is a parent will make a request for an evaluation, and then the parent would be contacted. And as Kylea mentioned earlier, it has to be within that 30-day time frame. The clock has started ticking as soon as you send that email, as soon as you send that letter. That's where that clock, the 30-day clock, starts for them. And so oftentimes they'll call a meeting, and they will have a lot of times the teacher and different people involved, and they'll talk about whether or not the school district suspects a disability. The district is not required to evaluate your child. They're able to say no, that we do not suspect a disability. So just because you request it doesn't mean they have to do it. And that's why you're building your case. That's why you're helping them see from your perspective. A doctor cannot write a prescription for an IEP. We see that a lot within the district. Just like a district can't make a medical diagnosis, a doctor can't make an educational diagnosis, although the school district does need to consider what the doctor has recommended. And so during this big meeting that they have where they talk about whether or not the district suspects a disability, this is some of the things that the district should be considering. So the district should be considering significant academic or behavioral concerns. A lot of times in meetings I'll hear, well, I don't think that happens very often. I always ask to quantify data. Can you tell me what not very often means? Right? How many times have they been sent to the principal? How many times do you have to prompt them in a normal school day to stay on task? So I would ask for specific information. The district needs to consider medical diagnosis, as I mentioned earlier. Any reports from the doctor that they provide, they need to consider those and the recommendations in that report. They need to consider any outside evaluations. Oftentimes, especially at the preschool level, we get students that are receiving speech and language services, for instance, at a private speech therapy facility. And so a lot of times they'll come to us asking for an evaluation, and we look at the outside speech therapy evaluation and oftentimes use that for a qualifying piece. They need to look at teacher observations. And so in the class, they'll ask the teacher how he's doing in class and asking for that specific information that I talked about earlier. They'll look at state and district-wide testing, how they've done in the past on state and district-wide tests, as well as any progress monitoring that they've done. The district as a whole should be having data team meetings to talk about the screening results for each individual child. And so children, every year, districts are required to do screenings in specific areas, and they do what's called progress monitoring. And so as a problem's identified, they don't want to wait to see if it gets worse. They want to provide interventions to see if the child can make progress. And so they would look at that information. They would look at any interventions that the district has provided already, as well as your input and any available data that they have to make a determination. And as we mentioned, they've got 30 calendar days to do this. Typically, they'll come to a determination at that meeting if it's a face-to-face meeting, and you'll talk about it then.
This next slide is common reasons a district might not suspect an educational disability. And this list is not exhaustive. The district is required to provide you with a copy of your parent rights. And in that, the booklet outlines various dispute resolution options and how to exercise them. So some of the reasons that they might not suspect an educational disability is there's not a significant difference between peers when reviewing the available data. So again, we're looking for that significant. So if you think back to that bell curve, we're looking for 2 standard deviations below the mean. That is the area that they're looking at, not just below. Speech, sounds, and patterns may be developmentally appropriate. Progress is being made in their current multi-tier system of support, or there hasn't been enough time to determine if the progress is being made in that current MTSS intervention. A significant amount of time or a significant amount of missed instruction or absences. So they want to make sure that it's not that your child hasn't been attending, that they don't have that skill set because they haven't learned that skill set because they weren't present for that. Student may only need a 504 plan to accommodate to access general education curriculum, and different performance or behavior at school versus home. But again, this is where you want to take your data and try to prove your case. If a school district decides that they do not suspect a disability and they decline to conduct an evaluation for the special education services, again, parents have several options to ensure that their child's needs are appropriately addressed. And here's some things that there are some things that parents can do that we'll get into later. So what to do if a district declines to evaluate? So understand the district's decision, review the data and the evidence, Continue to collect data and know your rights. That is a huge piece. I work with a lot of different parents that don't understand that they have rights and they don't know where to find those rights and they don't know what they can do to access that. So hopefully the information we give you here will help kind of guide you and will tell you where you can find all that information. Parents have specific rights under the Individuals with Disability Education Act, which is IDEA. And if they disagree with the school's district, their rights include the right to dispute a resolution. Parents can pursue an informal or formal resolution process if they believe that the district's refusal is not justified. So you want to understand the district's decision. The school district is required to provide a formal written explanation called the prior written notice that outlines why they do not suspect a disability, the data or reasoning behind their decision, and their recommendations for the next steps, such as continuing with a general education intervention or 504 plan accommodations. Parents should carefully review the prior written notice to fully understand the school's reasoning and any data that they are basing their decision on. Review the data and evidence. Parents should gather their data about their child's performance at home, in the community, and other professionals, so such as when we talked about the speech pathologist or OT, or if they receive therapy outside. We constantly provide information to school districts for students that we serve that come to us for a different type of service. We let the district know what we see and behavior supports that we have in place and any evaluations that we have to help formulate that request for an IEP or an evaluation. Key points to include is academic performance, behavioral concerns, and then the multi-tier system of support interventions the school has tried and whether they were effective or not. Again, we talked about continuing to collect that data, keeping records of teacher communication, how the child performs in different settings. All of this is all documentation to build your case. And documenting behavioral concerns that are not seen in the school, as we talked about, the masking or the huge meltdowns over doing homework, or anything that you might see in the home that is related potentially to their needs. And then know your rights. Again, parents, you have specific rights, so you can dispute if you want to, and it can be informal or a formal resolution, as we kind of mentioned.
We're all the way to step 3. It's a lot of information, isn't it? It's a lot of information. It's interesting, like we do this all the time. We're so used to working with it and understanding it and talking about it, and we live and breathe it. But when you go to put it down on paper, when you go to make slides and try and figure out the logical way to share this information, it really just reiterates to us what a confusing process it is, what a hard process it is. So. Step 3, and so if the district determines that they do suspect a disability, there are some specific steps that they must take. If you're in a face-to-face meeting like we talked about early for that, whether or not they suspect a disability, oftentimes they'll do the planning right there at the same meeting. And so the multidisciplinary team needs to develop an evaluation plan, and it outlines different areas that they suspect may need to be assessed. And these could be, for instance, academic areas, behavior areas, areas of communication and motor skills. And then they'll talk about the specific tools that are used. And so, and this is, I'm not gonna lie, this can be an intimidating meeting because you've got a lot of people involved and they're talking about the areas to evaluate. And so, what they're going to look at in the planning form, I actually gave you a copy of the planning form. It looks like this. And so I just want to glance with that with you. And so, of course, they'll gather the appropriate information, but you see the line under evaluation planning form, it's like 5 lines down, it says suspected disability. Do you see that line? Suspected disability. It's under team chairperson, right? Okay, and so suspected disability. They need to list, and as a parent, you need to be careful and have them list all the suspected disabilities that it may be. So for instance, a lot of times autism and ADHD have a lot of overlapping qualities. In the state of Ohio only allows you to choose one disability to qualify you. And so you want to make sure and include all the suspected disability categories, because what can happen is if you only choose ADHD, and really it's the autism that is a part of that ADHD piece of it, there are some implications for choosing a different category. And one of them being the scholarships that are available to you and the money available to you on those scholarships, because those are driven by the disability category. And so you always want to make sure that you have all of the suspected disability categories. They can suspect as many disability categories as is appropriate. You're just listing that as a possibility of an outcome. And so that was an important piece to me, and I've run into trouble with that time and time and time again. Because it's not easy to change a disability category. You have to go through the evaluation process all over again to change a disability category. And so it's important to determine which disability category is suspected, and then be pretty exhaustive in that, I would say. And then also, if you look down, there is different information that is areas to be assessed by a team. And so what they'll look at all of these different areas. Some of them are academic, some of them are behavioral, some of them are motor skills. They'll talk about whether or not that area needs to be assessed. Again, be sure to advocate well for your child. So for instance, fine motor skills is probably one of the most highly contested areas to evaluate. I feel like you might have different experience with your area, but fine motor skills, because you look at it and I'm like, I can't read my son's writing. I can't read what it says. But school sometimes have a different view on that. So just be prepared to bring your information with you. Bring all of that stuff with you. It's not going to hurt them to add a category. It's not going to hurt them to evaluate for handwriting if that's the case. But just be prepared to advocate for that. And so as you're thinking through your child, thinking through all of the different areas that you see your child struggle with, and then you're going to discuss those, and you're going to talk about what type of testing, is there enough data available? In other words, will they do direct assessment, or will they just gather information from educational records? For an initial evaluation, most of the time they will do direct testing for most everything. In the reevaluation process, sometimes they do what's called a records review, but you're going to be inclusive and look at all of those different areas that need to be evaluated. It should be a comprehensive evaluation. In other words, it's not just a single thing a lot of times. A lot of times, the educational struggles a child has can be caused by a lot of different areas of struggle. And so the evaluation should be comprehensive enough that it accurately reflects your students' needs in the classroom on a daily basis. Just because a student has a speech and language disability doesn't mean they might not struggle in reading as well. And so you just have to just make sure and that you're advocating well. It considers, the comprehensive evaluation should consider all the different areas of a student's abilities, including academic performance, so all of those tests that we talked about earlier, the classroom observations. Although grades is not typically a factor used to say whether or not a student has a disability, it is a data point. It is data, and so they would look at that, as well as their levels. So where are they performing the different academic levels? The school psychologist can provide academic testing to do more targeted assessments to find out what area of reading are they struggling with, what area of math are they struggling with, and then that will provide the team with information to know whether or not there's an educational disability and then how to support that educational disability. The school psychologist can also do cognitive and psychological evaluations. They also do behavioral assessments. There's some pretty detailed behavioral assessments that are often done that talks about just the different areas of concern. So withdrawal, depression, hyperactivity, all of those different categories. Also developmental and social emotional evaluations in addition to medical and healthcare information. There's observations and interviews. Oftentimes a school psychologist will go into the classroom and do an observation of that student. They'll time how many times the student was prompted, how many times the student was on task or off task. They'll describe the student's behavior in the classroom and just give a detailed outside observer point of view about that student and how they're functioning in that general education classroom. There's also functional and adaptive assessments that they can provide as well. One of the biggest ones that I think we miss a lot of times is social pragmatics, which is directly tied to a student with autism in addition to other categories. And so a student with autism oftentimes has very high vocabulary skills, right? They can talk till the day is done about Minecraft or about football or about whatever their main interest is, and you talk to them about it. They can stay engaged with you. They can go back and forth because it's a topic of interest. They know all the vocabulary and some very strong vocabulary, but yet, if you have a personal conversation with them and you try to talk with them about something that you're interested in, right, they always, I shouldn't say always, at times they'll try and redirect it back, right? It's that social pragmatics, not knowing how to read the social cues of other people, not knowing how to respond in an appropriate way when there's a dispute that's happened between them and someone else. And so all of those things fall into social pragmatics, and it's actually a form of communication that a speech and language pathologist would evaluate. And so I had one family, in fact, that talked to me, and their student was struggling because they would do whatever someone asked them to do. They were a kind and caring student. And so if you asked them to do your homework, they would say yes. And so oftentimes the student was being taken advantage of just because of their kind heart and that they couldn't read the social cues that they were being taken advantage of. And so those are things to consider and think about as you're advocating for your child. You have to think about all of those different areas that perhaps you wouldn't typically think about. Oh, I did one other thing. Medical information. So you are not required to provide the district with medical information. You're not required to provide them any reports. However, just know that that might impact the disability determination. I had a family, in fact, that did not want to provide the neurology reports. And the reason was so valid. The reason they didn't want to provide the neurology reports is they didn't want the district to have a low view of what that student could accomplish. They felt like without the neurology reports that they were more able to advocate for high expectations for their students. And guess what they did? They did a great job of advocating for their students. And so you're not required. They will ask for it. Oftentimes they'll ask you to sign a release, but remember that is always your decision whether or not you want them to evaluate a certain area. Another highly contested area are IQ tests. Oftentimes IQ tests can be counterproductive in the educational setting. They're also very beneficial in a lot of ways as well. But just really think through the implications of having those scores reported and a part of their educational history forever. I don't know if you have anything to add to that.
There's just so much with the evaluation process and what you can evaluate and what assessments you can use. And you have quite a team of people that are working on that, which it is very helpful using that form. It allows everybody to know who's responsible for what and how they're going to collect that information, which I think is very helpful. As a provider, I know, okay, I'm going to send over all of my behavioral assessments. I'm going to send, the last 3 months of ABC data, which is data that we collect based on antecedents, behaviors, and the consequence of that. And that's all very helpful. I work primarily in the behavioral section, so that's normally the area that the box is always checked and my name written next to it of what we're going to provide and how we're going to provide it. And so we talked about this. Reevaluations occur every 3 years for an ETR. And so this is really important. Again, they're going to go through this whole same process. They're going to fill out the sheet and they're going to say who's going to do what. And they may do some records review this time through if it's not the initial. One thing that I do advocate for is that don't continuously do record reviews. Because I have seen this. I have had a 15-year-old, and the last evaluation was done when he was 6, when they actually did the full evaluation. He is a much different individual than when he was 6 years old. So I encourage you to go through that full assessment, but I also look at assessments that are not necessarily going to be beneficial for your child. So I don't necessarily like to put all of my students through an IQ test if we know that the results are not going to change the eligibility. And then it's just kind of a pointless task for them to have to sit there and go through this assessment, or they're not appropriate for it. It may not be the best evaluation for that individual. So you can have a little leadway on this when you're working with your district, but reevaluations, they occur every 3 years. And the team either agrees to continue with services, or the student does not qualify for services. And so this is done every 3 years, like we said. And the planning can occur up to a year beforehand. So you might have this planning meeting where everybody's like, okay, everybody's doing this, and that. And then we will have our next ETR meeting in like 8 months. And that's so that everybody knows what data collection they're taking, because sometimes you need that extent of data collected to be able to really get a good picture of that individual. And again, every 3 years. So the evaluation is really going to drive the IEP.
Okay, so here we go. We've requested the evaluation, right? You've had the planning meeting. You've determined that the district suspects a disability. And so step 4 is that multi-factored evaluation, which from a parent's perspective, you are a part of the evaluation process because there are often checklists and forms that the district will ask you to fill out. And this is where you're allowed to and you're able to report accurately what you see at home, and they report that within the evaluation meeting. And so each evaluator during this time, either during that 60-day window if it's an initial evaluation, or perhaps that year window if it's a reevaluation, each evaluator that you've noted on that planning form will evaluate and score any assessments that they've been given to the student. And then they put their findings in a report. Each evaluator is required to write their own report. And so the evaluation team report will have several different evaluators speaking in that report. The evaluator's report will include any applicable background information, including outside testing that perhaps you've provided. It'll include the evaluator's observations of the student, the results and the interpretation of any assessments given as a part of the evaluation. And then the bottom 2 sections of the report are they're all important, but this is really where you clue in to whether or not the evaluator suspects that they have a disability. So the bottom 2 sections of an evaluator's report is always a description of the educational needs. This section summarizes a student's strengths and weaknesses, and then it also identifies any identified needs of the evaluator's assessment. That should include the child's school current skill level, as well as their functional levels. It should indicate any difficulties the student may have in accessing or making progress in the general education curriculum. It should always be in a parent-friendly language, so when you read it, it shouldn't be gibberish. You should be able to figure out what the evaluator is trying to say. And then it should also provide direction for access to the general education curriculum. The bottom portion are the implications to the instruction going forward, and this is where they detail what should be done. It should address the proposed supports and services to address the child's educational and functional needs. It should be individualized and specific to the student. It shouldn't be a cut and paste job. So this section should not look the same for every child. Every child needs different accommodations. Every child needs a different type of instruction. There may be similarities, but it should always be tailored to your child. And it shouldn't contain a predetermination in that, so they're not going to say this child qualifies for services, but it will make recommendations about that. And you'll see that in the language.
We've made it to step 5, the evaluation team meeting. So for the initial evaluation, the team must meet within 60 days of the date of consent to discuss the results of the evaluations and to interpret those results during that meeting. There is going to be a variety of individuals that attend that meeting. It could be a school psychologist, special education instructor, general education instructor, parents, obviously, guardians, anybody that you want to be a support unit, other specialists as needed. You can have speech and language pathologists, OT, PT, behavioral specialists, or a BCBA, such as myself, and there may be medical professionals as well. Some individuals do have conditions which would make them medically fragile, which would be impactful to their day-to-day within their school, so that might be a really appropriate person that could attend. So as we discussed, once all these assessments are complete, we analyze the data and determine whether they have a disability as defined by IDEA, and whether that adversely affects the student's ability to access and make progress within the general education curriculum, and whether the student requires special education services to address their needs.
And so we're finally to the eligibility determination. And remember, an educational team, a school team is not allowed to predetermine a disability. This should be a discussion that happens at the meeting based on the results of the evaluation. And so to qualify for services, this is section 4 and you'll in an evaluation team report. There are 3 questions on this document, and it's a state document. And these questions, you have to answer yes to the questions that are listed in section 4 of this. And you'll go through them together as a team and determine whether the answer is yes or whether the answer is no. The first one is a rule-out question. I think it's worded so crazily, but it's a rule-out question. And so you are ruling out that the determining factor for the child's poor performance is not due to a lack of appropriate instruction in reading or math or limited English proficiency. And then for a preschool-age child, the determining factor isn't just lack of preschool academics. And so you're ruling out that it's not a lack of instruction. Remember earlier we talked about absences being a factor and not suspecting a disability. If a student has missed a significant amount of school, then they might not qualify for services based upon that. And when I say significant, I'm talking about significant, not a day here and a day there. It's oftentimes months of days. But that's a rule-out question. So yes, that's not the reason that the student is struggling in school. Does this child meet the state criteria for having a disability or continuing to have a disability based on the data in the document? So they're going to go back and look at the definitions. They're going to say, okay, based on the definitions that the state of Ohio and IDEA defines, do they meet that definition? And then thirdly, does the child demonstrate an educational need that requires that specially designed instruction that we talked about earlier, that instruction that is different from the rest of the general education population? And so if the team answers yes to all 3 of those questions, then it would be determined that the student has an educational disability. And then you're going to determine which eligibility category, which disability category on that planning form that you've listed best meets the student's evaluation, right? So which one, sometimes there's often several different disability categories that you could choose, and you're always going to choose the one that best describes your student. And then finally, if you answer no to any of the questions, then there is no disability suspected.
So going back to if the team determines that there's no disability, understanding what you can do. So we talked about reviewing that prior written notice and their reasoning and why they do not suspect a disability. You can also review all of the evaluations that were done to determine whether or not they were eligible and get more information from there. You want to make sure that you keep open communication. So requesting meetings, collaborating with school staff, keep collecting your data so that you have your information if you need to come back to the school. And then you can explore 504 plans, which we are going to be doing another presentation on that coming up in October, where we discuss the difference between an IEP and a 504. And so that would be a great time if you have questions about that to attend that presentation as well. And you can also seek support from external resources. There are parent mentor programs, the Ohio Coalition for Education of Children with Disabilities. They provide resources, advocacy, and training for parents. There's the state support team. There's the special education roadmap, and it helps you navigate what the special education process is and how to utilize your rights as a parent.
So I know we're running out of time. So yes, so you do have rights as a parent. And as we mentioned earlier, there's a guide to parents' rights in special education that a school district is required to give you at least once a year, but they should give it to you with every meeting that you have. In that booklet, it contains your rights as a parent. And so, for instance, part of your rights, I do want to mention this top little bullet point. You do not have to sign that you agree. Do not feel pressured by a team to sign that you agree with their reporting. If you disagree, you mark disagree, and they may ask you to sign or write a letter of disagreement to explain why you disagreed with their assessment. You do have the right to ask if you've been evaluated. If you've gone through the evaluation process and they've determined that there's no disability, then you would have the right to request what's called an IEE. And so it is an independent education evaluation. And so it's done by a third party, someone not affiliated with the school, and it's at the district's expense. And so this is one of your parent rights. And oftentimes people do exercise this right. The district is not able to say who to go to. They're not able to tell you have to use this provider for the educational evaluation. But what they can do, they are able to give you certain guidelines or criteria. So for instance, we live in Ohio, so they're not going to pay for you to go to California, to go to a certain doctor in California in order to get an educational evaluation. So they might put some limitations as far as the distance away and things like that, as well as the credentials of the doctor. I've given you in the handouts, there is a map of the dispute resolution options. And so it looks like this. And this is Ohio's dispute resolution processes. And these are the different options that you have if you disagree with the district's decision that your child does not have a disability.
So just on the next slide, we have tips for the evaluation team meeting. So be prepared. Understand the evaluation results, know your rights, ask questions while you're in there, bring somebody to support you because it can be overwhelming. Focus on your child's needs. I have a lot of parents that will bring a picture of their child to the meeting and have that on the table so that everybody can reference who they're speaking about and that understanding that this is a child and it is your child and a reminder of why we're having this meeting is to best serve that child. Making sure that you have comprehensive information is considered. Advocate for comprehensive services. Remain calm and collaborative because it can be intense sometimes in some of these meetings, especially if there's a disagreement about the disability or the level of need. So remaining calm helps you to think clearly and to communicate effectively. And then if you need, request that independent educational evaluation, document everything, and then follow up. Continue to follow up on that. And then we have a list of additional resources here. And I believe we've got we have the evaluation roadmap. There is a guide to parents' rights in special education. The district parent mentor, Montgomery County Regional Center and State Support Team, the Ohio Coalition for Education of Children with Disabilities, early resolution information fact sheet that allows you to look through all that information. I believe we've got that printed off as well. And then the Ohio Dispute Resolution Information Chart, which is that chart that we do have there. So this just kind of helps guide you on what you can do if there is a disagreement. And I don't want anybody to think that the district comes in and is like, no, all the time, because a lot of times this is very smooth, very easy. It is not a difficult or combative situation, but there are times that, especially if there is a disagreement, it can be difficult. And
And yeah, I'll just second that, Dr. Kylea. Oftentimes it is a smooth process. It's an emotional process always, but oftentimes it's a smooth process. But I think as a parent mentor, that's one of my goals. I want parents to understand their rights. I want to know what you can do. And oftentimes you don't have to invoke those rights, but just having the knowledge that you do have these rights helps you not to feel helpless in the situation, and it gives you something that you're able to do. And so in conclusion, we hope that we've helped you to understand the difference between a medical diagnosis and an educational disability. We hope that you understand the steps in the evaluation process, and then understand that your rights are powerful. Your rights are powerful. And so finally, to wrap it up, are there any questions that you guys have?
I'm interested in this emotional disturbance category, guys. I didn't know specifically about. We had our evaluation initial meeting. We talked about everything, and now it's in the process of. I don't think they've done any. I'm not sure what if any steps they've done yet. I don't think they've done any assessments. What? Just observations, I guess. Is it too late to go back and say, I just educated myself, a little further, and I've been looking at this emotional disturbance category and see a lot of criteria that I feel like my child needs. Or can we make sure this is assessed as well or included?
So they will assess across multiple areas. The one thing that I always like to keep in mind, especially if you have a medical diagnosis of autism, that if you want to access any of the scholarships that the state of Ohio offers, to access such as the autism scholarship and getting that full amount, you have to have a diagnosis of autism listed on there. Now, that does not have to necessarily be their main eligibility category, but you want to make sure that the autism is on there because they can do, they have modified it this year to allow other diagnoses. But sometimes if you are given a certain eligibility category, that dictates how much funding you may get if you choose to access one of those scholarships, such as if you access the John Peterson Scholarship. They have a variety of different disability categories, and there's funding tied to that disability category. So emotional disturbance is going to get less funding dollars than traumatic brain injury or an autism diagnosis. And so those are just things to keep in mind as well. But again, you can have all these different disabilities listed in medical diagnosis, but it may be this is what is the most appropriate diagnosis, the educational category for the educational disability may be this emotional disturbance over the autism because of all those different criteria that's listed in there. And so you can always request at any time to have those items evaluated. You can also request to have amendments done to your IEP. It's a fluid document. So if things change within the year, you can go back and say, hey, I want to have another IEP meeting. I want to make some amendments. And the district can easily do that with you because there are sometimes major things that happen. And that child is not the same child of when that IEP was given to them. And also IEPs are done on a year basis, so it's not always at the first of the year. It could be in the middle of the year. It could be towards the end of the year. So there may have been things that changed. Maybe that child changed over the summer, and now they're a different kid going into that next grade level. So you can always request to have amendments done.
So if you do try to, since we're still in that beginning stage of the evaluation, does that start the clock over again?
So they can amend, just like they can amend an IEP, they can also amend a planning form, and it does not start the clock over. And so if you wanted to add a disability category to suspect, it's easy, super easy to do. And as Kylea said, you just want to make sure that they're evaluating the appropriate areas to support that category. And then I also add to what Kylea said, the Autism Scholarship, for the John Peterson Scholarship, it has, as she mentioned, the 13 disability categories, and there's funding. And this is if you accept a scholarship. There's funding associated for the different disability categories based on the category. Autism scholarship, the law recently changed, and so previously you did have to have an educational diagnosis of autism to access the autism scholarship. Currently, the law states, they changed it, this is a new change from last year, a medical diagnosis will also allow you to access the autism scholarship. So even if you have an educational disability or category of, we'll say, OHI minor or emotional disturbance, but you have a medical diagnosis of autism, you can still access the autism scholarship with the autism funding amount. Based on a medical diagnosis. There's just another set of criteria that you have to do, but it's super easy. It's getting a letter from your doctor on letterhead with a live wet signature on it, and then the school district is responsible for writing an educational plan. And so it's not an IEP in that instance, but it allows you to access the scholarship more easily, and more families. It's accessible to more families.
How do you, are there multiple autism scholarships? How do you access them? Does the school offer them? And what do you do with them? Yeah, what do you?
So there is the Autism Scholarship, and then there's the John Peterson Special Needs Scholarship. To be able to be a provider of that, you have to meet specific criteria, and you have to show the state that you meet all that criteria. And so there are a list of variety of providers, and they all can provide different types of services as it relates to that. The important part that I always let parents know is that you're waiving your rights when you accept the scholarships. So that means that if they were getting related services and you've decided that you do no longer want to attend a public school setting, you would like to attend a facility that maybe specializes in that, or you're going to homeschool your child and you're going to access services through something else, you waive your rights to all of those related services, free and reduced lunch, transportation, anything that would come with being in a typical public school setting. And so I always tell parents, read the fine print, and I have families that they love the scholarship. It is the best placement for their child is to be out of that public school setting and into an environment that is maybe one-on-one, small group.
It funds, like you said, you said June City Behavioral
Solutions, yes. Yeah.
So, there are multiple facilities like that around that you can, and then the scholarship pay, is that the tuition based, I guess?
So it's service-based, and each provider is going to be a little bit different. So at Jim City Behavioral Solutions, we provide a lot of one-on-one and small group. So that kind of changes how much services cost based on whether it's one-on-one versus in a small group. But there are a lot of providers out there. There are some applied behavioral services. They provide more of a group setting. So there would be like 4 to 8 kids in one room with an instructor, which is still a smaller ratio than what a lot of public classrooms are if they're in the general classroom. Now, a lot of school districts have very great special education programs that really facilitate growth and learning within the district, and so families that are getting what they need within the district don't need to look at the scholarship because they want to keep their placement, and they can look at outside services using other insurance. Yeah, so we have a lot of kids that come to us that love their school, love to be in the school, and so they receive ABA services or mental health services through their insurance as opposed to waiving their rights to the public education with accepting the scholarship. It really just depends on what's best for your child. If the public school setting is great for them and they're thriving and they just need a little bit of extra support, stay with the district. You're going to get so much more with that. But if that is not the best placement, then look at other service providers. And a lot of them too have those related services that you can access as well. It just, the scholarship dollars only get you so much. So that's also another thing to think about. I mean, a lot of people look at that funding amount and they're like, wow, that's a lot of money. But it's not a lot of money when you have to pay several other professionals that are working to make sure that you're getting all the services that you need. So just kind of keep that in mind. But there are a lot of providers, and you can look them up on through the Ohio Department of Education and Workforce. You can also call around and see, and I encourage families tour facilities, find out what they have, and don't just make your decision. I would not let people just to come to our facility because I spoke today. Instead, I want to make sure that we're a therapeutic match for your child, and that we're going to be the best able to serve your child. And so that's why we do tours, we do pre-assessments at our facility. We want to make sure that we match you up with who is best for your child.
So the Ohio Department of Education Workforce, is that like a website itself?
Yes, so that's the state website.
Yeah, and it is on their website, but if you were to Google Ohio Autism Scholarship, if you just Google it, that's what's going to come up. And so you'll go to their webpage, and it's going to have all the information, including parent FAQs. In addition, they'll have a provider search tool, so you're be able to search for providers. You can search by county. I would say search by Montgomery County and Greene County and maybe Warren County, just the surrounding areas. There are a lot of different settings, so Gem City being one of the types of settings, but there's also different school settings as well that are also providers. It's wild, right?
Yeah.
But yeah, it is in lieu of public education, though. And so it's if the public school setting isn't right for your student or your family, then you can look at that. And Ohio does a great job of providing funds to assist a family in paying for those options.
I wanted to interject something because this is something I learned the hard way, is if you go to an autism scholarship school, even though they're getting money to provide the support for your kid, they are not absolutely required to follow the IEP.
That's correct.
And that was a hard learn for us. There were reasons why we took our son out of public education, and they're good reasons. But yeah, we discovered that the teachers were not special ed teachers, and that they, we could demand it, we could ask for meetings and such, but if they didn't provide, services in the way that he needed, there wasn't much we could do.
And that's a great point, Melissa. And this might be a great topic for a special education roundtable coming up next year, are the scholarships, because there is a lot of confusion, and they are, I'm not going to say tricky, but just like everything else in the special education process, it's confusing. And the trial by error is a problem, because for a scholarship, there is an IEP that's written every year, but it's really as so the parent can make a fully informed decision of knowing what education would look like if they were in a public school system. And so it's a comparison document between what would education look like in a public school system, and then what can my scholarship provider provide for me. And so it is. I think that would be a great topic of discussion.
Fabulous.
Yeah.
So, can I ask one more small, just really
Yeah,
quick? Just your facility in general, because you're
Yes.
here. Is it like a full day, like a school day, and then they graduate from such a place, like get a diploma?
Yeah, that's a whole nother topic as well. It's
They're homeschooled.
yes. So when you take the scholarship, you can register. You should register as a homeschool student unless you are attending a private school facility. Then you wouldn't be registered as a homeschool student because you have to show that education is occurring in some way. Now, our facility is different in the sense that we support our parents with the homeschool. So we provide specially designed instruction, we provide materials, we provide learning platforms. We let you clearly know who is providing what service. So we are required that our staff are all qualified mental health specialists. They're also registered behavior technicians, but then we also have licensed professionals on our team as well. So you have BCBAs, you have licensed independent social workers, we have licensed music therapists, we have we have intervention specialists. We have a variety of teams. We let you know who's doing what with your child. But again, we support in a lot of different ways. We help you build your portfolio. We write the information at the end of the year to show the progress that they've made. We opt to do that instead of state testing because we feel that the portfolio and the written narrative give you a better snapshot of what your child has accomplished as opposed to sitting them down and doing a standardized test. I feel like we're not going to get the best snapshot, for at least for the clients that we work with. And that might not, that can vary across everybody. So we try to be upfront and with what services we provide. based on what you need depends on the level or how many hours you would get per day. So we write treatment plans, let's say you wanted ABA services. So we would write a treatment plan based on that, and then we would prescribe an amount of hours based on what we feel is medically necessary based on the need. That kind of informs how many hours you would get of that other insurance-based services. Now for our autism scholarship students, we look at, okay, do you need to be one-on-one or can you be in a small group? And then that determines how many hours you get. We do have some kids that come to us for a full day, but their autism scholarship is supplemented with either mental health services or another funding option, just based on our model. Now, there are other models out there that they provide a higher ratio of students, which then would cover, maybe 4 hours a day, 5 hours a day, but it's in a higher ratio. So a lot of that just depends on how many students are in there, who's all providing that instruction, how much support do they need.
And so I'll add, you asked about the diploma. And so for a lot of the facilities, unless, like Dr. Kylea said, it's a private school, private academic setting. Homeschooling laws also changed last year. And so there's a lot fewer requirements for homeschooling and what you have to provide for homeschooling. But the current law says that if you're a homeschooled student, that as a homeschool family, you are able to provide a diploma. And so it wouldn't be the facility, if it's someone like Gym City, it wouldn't be them providing the diploma, you would provide it as a homeschool family.
I will say that at Gym City, we do actually help you go through that process. So we go through and make sure that you've met all the criteria, that you've got all the different classes that you were supposed to have, meeting that 20-hour credits that we're looking for in those different subject areas. And then we write up a whole thing of here's all the classes that they took and when they took it and how many credits they got for that. And then it's essentially like a record of all of that. And then we go through the National Homeschool website and we issue a diploma through them. But it would be through your homeschool. So a lot of times our families choose to say, Smith Academy, whatever their last name is. And so that's what's on the diploma. It is valid and it is good to be able to, let's say they wanted to go to college or they wanted to go to a community college or anything like that, they have to be able to accept that. And that was some new laws that were changed a while ago too, even though they just changed again. So there are options out there. Now I can say as a facility we do this. Don't know if any other facility goes through all that. So you just have to research and ask that question.
I've actually got a county kid, our daughter,
Yeah.
lunch. Thank you.
Thank you all. We appreciate it.